Hi, my name is Maddi Niebanck, and I'm the host of the NeuroAnimation Grow Your Brain podcast and a stroke survivor. I know firsthand all too well how difficult it can be when you're discharged from the hospital full of hope, thinking that you have all of these options for your recovery, only to go down that journey and discover that your options are shrinking. Today, I'm very excited to be joined by Dr. Whitt, a physician who works in brain injury, stroke, Parkinson's, and today he is going to share the physician's perspective of the neuroanimation therapy. Dr. Whitt, thank you for joining us today.
Hi, Maddi. Great to be with you.
Awesome. Well, Dr. Whitt, maybe to start, you could just provide a little bit of background on your career and why this is important.
I've been an internal medicine doctor practicing medicine here in Central Ohio for the past 25 years. And during that time, I've seen thousands and thousands of patients with neurodegenerative brain diseases and stroke survivors and the such, and more recently with long COVID. This is an area that's been frustrating in my practice for treatment, for sure.
Now, Dr. Whitt, one thing I would like to do is just take us back for a moment to the beginning of a patient's journey, someone who has a stroke. When they go through their inpatient and then they're discharged, what, historically speaking, have been the options that a patient like that could have in their recovery?
As you know, I mean, a stroke is like a bomb went off, literally, in your head and in your life. And like any major medical crisis, it's like, what do I do? And your family's the same. And, you know, once you get stabilized in the hospital, and I think the expectations are very high for patients, and uncertainty is there, fear is there. And as you go through the process, stabilization through the hospital, and then from there you go to a either inpatient rehab facility or skilled nursing facility for rehabilitation. I think there's a lot of hope there that, hey, I might get all of my function back.
Definitely.
And then after however long people are there, because they're constrained by insurance companies, you know, lack of progress, and you're discharged from that facility to home, that's where the rubber hits the road. And that's typically when I start seeing patients and they're asking me, okay, now I had my left arm was totally flaccid. Now I can move it, but I still can't move my hand. What can I do next? That's where the conversation gets tough.
So before you had heard about neuroanimation, when you would have patients come to you after discharge, what would you typically recommend to them about what are their options for motor neurological recovery?
I would discuss with the family, you know, let's do more of the same, which would be PT, OT. Let's try maybe some new therapies that may or may not work, that are low risk but maybe high reward, natural supplements. There really wasn't much that we could do. And you hit the 6-month mark, and pretty much whatever state you were in is where you ended up 5 years from there.
I'm happy that you brought that up because that is a common theme that I hear amongst stroke survivors is this concept of the plateau. And something that I myself in my own journey have been told many times by doctors is like, you'll make probably a lot of gains, significant gains in the first 6 to 12 months. Yeah. And then, you know, you might, there's not really much hope beyond that. Like, we can't guarantee that anything would happen. What would you as a physician be telling patients are their options after this acute period?
Prior to neuroanimation, I would just try to come up with novel ideas with the patients. I mean, some patients are already trying stuff, and you're probably one of them. You're looking for anything, whether it's acupuncture or, you know, traveling to another country to try some treatment, and people are starving for something to help them, and the current standard of practice in medicine is just not helping them after a certain point. And so we're off in this, you know, world that we're trying to, you know, figure it out until neuroanimation.
And like you said, so many of us stroke patients were starving for this information. We will try literally anything that could potentially help us. Yeah. My left arm is flaccid, and I just want to be able to regain some movement. And maybe going into outpatient occupational physical therapy is not enough. It's not intense enough for me to be able to see real significant gains. and I go home and I can practice all of this on my own, but at the end of the day, I need an intense environment to be able to see the types of gains that I'm looking for. How, Dr. Whitt, this being said, I know you are a huge advocate of neuroanimation, so I'm curious, how did you first find out about it?
When I first heard about NeuroAnimation, one of my staff said that they were having an open house, and did you want to go, check it out? And I said sure, and I wasn't able to make it that day, and so she set up another appointment for a week or so down the road where I could meet with Dr. Ahmed. And after she went through it, I asked her what it was about, and I'm like, she said it was some video game, and I was like, really? I don't think I want to meet this guy, and So I ended up going, and God works in mysterious ways. And Omar and I, he came in, and I had a colleague with me, and we sat in the room. I listened to him go through his slides and tell me about neuroanimation and his results. And I remember afterwards I said, if this data is true, this should be in every hospital, every rehab in the United States of America, if not the world. It was that profound. And the other striking point from that meeting, he showed a curve for all stroke patients that showed the same plateau, whether you were at the best universities, the best rehab centers, or even, frankly, not the best. The results were the same, plateau, until neuroanimation. And he showed that you don't have to plateau.
So what about this neuroanimation therapy in particular stuck out to you?
Well, after he talked about how it works, it's increasing blood flow to the brain. It's a cerebrovascular issue. And that is something that medicine has not attacked. And if you look at things that we do that we say are healthy, exercise, omega-3 fatty acids, turmeric, things like that. One of the things those do is increase blood flow to the brain, but not to the extent that neuroanimation does.
So now it sounds like that info session where you first learned about neuroanimation was pretty significant and impactful to you, Dr. Whitt. Now, since you've learned about it, how do you approach your patients now who come to you seeking answers for their recovery?
Okay, so I was, as I said, very skeptical. So the first thing I did was I identified a few patients that I've known for 10 to 20 years. And I said, hey, you want to try this new therapy? It might help you. And I had two patients that agreed. The first one was a patient with moderate dementia, Alzheimer's, and she got to the point where she couldn't sign her name.
Yeah.
I've known him for 30 years, and if you know anything about Alzheimer's, I mean, it's the worst disease there is, I think. And there's this light that just they lose from their eyes. You can see it. And she was at that point, and she did a 3-week boot camp, and I saw her right after, and I walked into the room in my office with her and her husband. She was staring at me. She was talking to me. I saw the light. I saw the light in her eyes. Like, she's back. Like, I've never seen that, ever. And like we went back 3 to 5 years. And her husband said, I got my wife back.
So that's pretty incredible to see the light come back on in someone and being able to see them interact with their family and just be much more alive.
Yes.
I'm wondering, Dr. Whitt, since that patient, have you tried or recommended neuroanimation to others, maybe of different neurological conditions?
Yeah, so really I try to look at any brain problem. And so I did have a patient that had a stroke a year prior. He recovered pretty well. He was left with this thing called aphasia, where he could not retrieve words, but he understood if I told him the words, he understood the words. Very frustrating. So he went through the 12-week program. Halfway through, I saw him in the office. When I walked into the room, he was speaking 80 to 90% fluently, and his wife's smile lit up the room, and I just was, again, like, this never happened. Never have seen that in my career. And it's not documented.
It's so crazy to me to think about, like, how there are all these potential benefits, right? Like, for aphasia, there's obviously motor benefits that you can, motor improvements you can make, but then cognitive, and for people who have aphasia, like, there's really no limit to who can benefit from this, I feel.
Totally agree. And we see mood elevation, which I think you experienced. So I think anything in the brain that might be wrong, we can fix it with increased blood flow through NeuroAnimation. Now, I think the other part to this is going to be, and I thought about this early on, why didn't we come up with this years ago? We've been spending billions and billions and billions of dollars for decades on brain disease, and where have we come?
And I know, Dr. Whitt, I know you said that the NeuroAnimation can increase the blood flow in the brain about 120%, more or less. Can you help me understand what that means?
Anytime you have lack of blood flow to any organ, whether it's your skin or your heart or your kidney, it causes damage. And it could be maybe your arteries blocked 50%. It's not good for that organ. And so if you're not getting enough blood flow to the brain, it's not functioning properly. So you're developing toxins. You're not getting rid of the waste as good, because the blood brings in the nutrients, the oxygen, and it gets rid of the waste also. And if that's built, think about a city that their trash is piling up slowly over time, and it hits a critical
That's
point.
your brain.
Yeah, it's full of toxins. That in turn breaks down the cells, and then your cells die. And it in that situation, like Alzheimer's, Parkinson's, the neurodegenerative diseases, it's a slow, unremitting process. And the therapies that we have, they don't do anything to slow it down or reverse it. All they do is treat the symptoms. So in Parkinson's, what do? We treat the tremor.
Right.
That's not slowing the disease down. Alzheimer's, we don't really do too much. And this new therapy is it's a whole new class. It's a paradigm shift in what we're doing. Think about if you were alive before penicillin was invented and you had a pneumonia. What'd you do? I mean,
I don't know.
Nothing. You tried some herbal stuff, but you probably died. And that's probably one of the greatest discoveries we've had. And then more recently, the coronary artery stent. Prior to that, if you had a heart attack, and this is just in the 1980s or 70s, this is not that long ago. If you were having a heart attack, you know what? You went to the ER, they put you on morphine, and good luck. There was nothing else they could do. And so here we are. We're at that same point where we couldn't do anything. It was just like, good luck with your stroke, with your Parkinson's, with your Alzheimer's, with your TBI, with whatever brain problem you had, but not anymore. And that is the beautiful thing about it. So now when I can go into my exam room and I see someone, I know that they're having problems with their memory. I can give them hope. I got something to offer them.
Do you think, Dr. Whitt, that there's a limit? Like, I understand, for example, I myself am coming up on 9 years since my stroke, so I'm a chronic patient. And I didn't start NeuroAnimation until I was in my 8th year of recovery, more or less. And then I started to see that boost in gains. Do you think there's an ideal, most opportune moment for a patient who's discharged? Is it best that they come sooner rather than later, or can they still experience gains anytime?
I think with stroke specifically, yes, the sooner the better. And Dr. Ahmed can speak more to that than I. But I think there's going to be a sweet spot there, maybe 6 to 12 weeks. That if we get them quicker.
You would recommend to patients, regardless of how far out they are from their diagnosis.
Every single patient should do this. There's no risk, and there's all upside. That brings me to the next concept. This is a brand new concept. I mean, when we see it now, we're almost taking it for granted, like these miracles. But we're just early stages. So what we're going to do 1 year, 2 year, 5 years from now, I mean, look back at history. I mean, penicillin, we have lots of other antibiotics now. And so what we're going to do is envelope NeuroAnimation into the Brain Institute. And that is what's going to drive this. And then through the Brain Institute, we're going to, with the driver being NeuroAnimation as the treatment, what are we doing either, personally through our personal lives or medically, through medications that we're giving. Maybe our blood pressures are too low and it's causing brain damage. Maybe some of the drugs that we're giving people for 30 years are damaging to the brain. And that's what we're going to figure out. And that is going to take us to the next level. And if for a stroke survivor that's new or even 8 years or 10 years out, I think we're going to find new ways to help that person go to the next level. I think this really puts a spotlight on medicine itself, that it's so restrictive and not open-minded. This hopefully will change that. We need to change the way we approach diseases and treatment. It's I think we get trapped in, well, this is what the researchers said, and this is the way we're going to do it, and we're going to keep doing it for the next 30 years.
And it's not so cut and dry, right? Recovery is not a linear process either.
No, the body is so complex. We really don't know much about it. Like the universe, we don't know much about it. The brain especially is so complex. When you think about, there's probably 60 to 70 billion neurons in the brain, and those make trillions of connections. I mean, those are numbers we don't even understand.
I was going to say, I don't even know what that means, but it
sounds I don't think anybody
sounds
does.
Intense.
And if they say they understand, you need to run from them. Because we have to have some humility in medicine. And I think Dr. Ahmed definitely shows that. And he came up with a concept, and he proved it worked, and it's a great thing he's done.
Amazing. Thank you so much, Dr. Whitt, for joining us for this episode of the NeuroAnimation Grow Your Brain podcast. It's been a real pleasure to talk with you and hear from the physician's perspective about how neuroanimation is such a disruptor in the field at this time to help people with cognitive decline or people like me, stroke survivors, Parkinson's, traumatic brain injury. All of these people, what I'm hearing from you, could benefit from neuroanimation.
Thank you, Maddi.
To everyone who's been listening, who may have been told that you've plateaued or that you won't make progress beyond a certain point, I'm here to tell you that there is more.